This is the Cuyahoga County Safety and Justice Affairs Committee meeting, December 4th. I hope everyone had a good Thanksgiving, going into a hopefully good Christmas. I believe happy Hanukkah out there for everybody else. Roll call, please.
Calling the roll, Mr. Gallagher.
Here.
Ms. Baker.
Here.
Mr. Toomer.
Here.
Mr. Brady.
Here.
Ms. Conwell. There is a quorum.
Do we have public comment?
Yes, Ms. Leanne Lane.
Welcome. You, Ms. Lane, you have 3 minutes, as you wish. Ma'am, 1 second. I'll give you your time. You have to press a button.
I'm sorry.
Good, okay.
Okay. For many, there's no sense of urgency to correct the existing problems at the jail, but you should stop and consider how you'd be feeling if we were talking about your loved ones being treated this way. I have many concerns about the inhumane conditions currently at the jail, but I just want to focus on 2 of them today. First of all, the substandard medical and mental health care that so many of our loved ones are receiving there. My son was taking prescription medicine for mental health issues when he arrived at the county, but they denied him his medicine for 30 days. He was not able to see a nurse until then, and then he had to wait 2 more days to begin starting his medicine. Any reputable medical professional will tell you that it's unsafe to abruptly stop medication. A couple of months ago, he started hallucinating and having suicidal thoughts. He filled out a kite requesting to see a doctor. Needless to say, he's not gotten any response back from it. Actually, he's never seen a doctor since he got there. I fear for his life every day, especially since he's got many disorders. Anxiety disorder, one of them, is just one of many that he has. He's constantly threatened to be taken care of by the SRT team. He's called effing idiot, effing retards, and he's on a floor 2 that's supposed to be more for the special needs mental health thing. But secondly, my son is there for probation violations for alcohol-related offenses. He, along with countless others there, need help with addiction, but it seems like no one really cares. They don't understand that addiction doesn't care who you are. It doesn't care about your race, age, gender, where you are, where you live, or how much money you make. It does not care whose child it takes. Addiction can affect anyone. No family is safe from its threat. Currently, they're offered AA just 1 time a week, and that's not even guaranteed because most weeks it gets canceled because they're short on staff. Which leaves our loved ones with no resources for help while they're incarcerated, which plays a major role in creating a revolving prison door. Judges and prosecutors need to be better educated in addiction. If the underlying cause of the offense is never properly addressed and treated, the overcrowding in our jails will never end. The definition of rehabilitation is restoration of someone to a useful place in society. Cuyahoga County Jail is not rehabilitating anyone. Actually, they're releasing people in worse condition than when they first arrived there due to the inhumane treatment that they are receiving. They are not getting the medical or mental health care that they need in a timely manner. They are being put on a waiting list and they wait for months on end to see a doctor.
You can finish.
Okay, thank you. They wait months on end to see a doctor. With the 3 suicides and the 55 attempted suicides in the past 12 months at the jail, by the time that they do receive medical attention, it's often too late. We have to remember that they are someone's loved ones. This is completely unacceptable, and it's not enough for us to do nothing. It's time for us to do something.
Thank you.
Thank you.
You sent us that by email.
Something, similar to it.
I forwarded that to the sheriff the next day, I believe it was. I hadn't heard back, but he's sitting right there, so if he would take you aside. I think there was a concern about being able to contact you. We didn't have your son's name on that. I don't know if we had yours. I think we had yours, but we didn't have the contact. But I think I'm hopeful he'll be able to help you with that before you leave.
Because, a couple of months ago, I had started contacting everybody I could think of that could help me. I didn't know to come to you guys, but I contacted Sheriff Brown was one of the ones, and then he forwarded a email to the
He's
sheriff.
sitting right
so
there, he'll help you out.
Thank you.
Thank you. Anyone further?
No one else has signed in.
Okay, in your packets, we have the minutes of the October 16th committee meeting. If they're in order, I'll accept a motion.
Second.
I have a motion and a second. Any discussion? All in favor?
Aye.
Against? Thank you. Resolution 2018-0236.
Resolution number 2018-0236, authorizing an amendment to contract number CE 1800178 with Shores Uniform Corporation for uniforms for the period 3/19/2018 through 3/18/2021 to extend the time period to 12/31/2021 and for additional funds in the amount not to exceed $570,000.
Good afternoon, council members. This was actually a mistake I made earlier in the year. When I did this contract, it was a 3-year contract and I did it for $200,000, which $200,000 covers about 1 year's worth of CO uniforms. So I did it, it went in front of the Board of Control, and then once we realized what I had done, I needed to amend it to continue it on for the remaining years. And plus we added a little more time and enough money to get us through the entire, this will end up being a 4-year contract really when it's all said and done. But then the amount of money we're amending it for would get us through the 4 years, because again, it's about $300 per CO, give or take. And it costs us anywhere from $185,000 to $200,000 a year to uniform these COs.
And you are?
Oh, I'm so sorry. I am Donna Cleo. I'm the sheriff's fiscal manager.
Yes, I know who you are. But are there questions about this legislation? Okay, and looking at the dates, obviously you'd like this to go forward because we're behind.
What I did is I modified and I moved some of next year's money up into this year. So we're paid in full for this year. I just
Right.
don't have any money from 19 through 21. And that's what this amendment will do. But we are paid in full as of right now.
So it's not an emergency?
It's not an emergency,
Okay,
no.
I was looking at the March 19th date. So, all right, if the, yes, ma'am.
Through the chair to Donna, the 570, does that include just the remaining of the 4 years, or does that include the 200,000?
No, the whole contract will be for 770 because it'll be about 4 years. And like I said, it ranges from 185 to 200 a year is what it costs us for these uniforms. So the 570 is in addition to this year's monies up to the 200,000.
Thank you.
Sure.
Anything further? Okay, we'll move this on to the council agenda for 3 readings.
Thank you very much.
Thank you. Do I have to accept the motion to move that forward? So if I could, please have a motion to move Resolution 2018-0236 to the full council for 3 readings.
So moved.
All in favor?
Aye.
Against? Thank you. My mind's a little bit, did I forget my glasses today? No? Okay. 2018-0251.
Resolution number 2018-0251, making an award on requisition number 43173 to Unsolved Intermediate Holding Company in the amount not to exceed $588,000 for a mass notification system for the period 12/12/2018 through 12/11/2023.
Good afternoon, Council. Brandy Carney, Chief of Public Safety and Justice, and I also have Mark Christie, who is in charge of our emergency management group with me. We just have a few slides for you today, sir. Can I get started?
Yeah, okay. Hello, everyone. Thank you very much for having us today. I'll be brief. We're here today because we are trying to implement a new mass notification system in Cuyahoga County. In 2013, we implemented our first mass notification system, went through the RFP process back then with the intention of having a countywide interoperable mass notification system to be used for county purposes, as well as to be made accessible to the communities and departments and organizations in our county to use for their local messaging. Several years later, 5 years later, We have used the same system, Gov Delivery, and I'm happy to report we have 26 communities currently using the system and 12 county departments and organizations also using the system actively. The system is used routinely for weather warnings, Amber Alerts, critical county news, and it's really been a success story for the county in that it truly is countywide and interoperable, and it's been a model or an example of the county's ability to share services and costs among the communities and its regional entities. In the beginning of 2018, we were made aware that our current vendor, Gov Delivery, was no longer going to provide the mass notification solution as part of their business suite, at which time we began to develop an RFP to replace that vendor. We worked with representatives from our public safety fiscal division, from CCOMS, County IT, Mission Critical Partners, a third-party consulting firm, and 2 user communities, the City of Rocky River and Strongsville, to develop a robust RFP based on technical expertise and a lot of lessons learned along the way. So we were very proud of the product we put forth. We thought, we developed a really good product, or a really good RFP that would help us select our replacement vendor and move the program forward. In addition to the rigorous technical specifications that were included in the RFP, we also placed special emphasis on the preservation and use of the data that we had collected as part of the current system. Being able to transfer that into a new system is very important to us. A lot of marketing and efforts were put forth on the county level and also the community level to include subscribership in the system. Also, training support was a priority for us. We know that now that we have a new system that would be implemented, that we'll have to go back out to our community users and our organizations that use the system and retrain them. And finally, capabilities for reaching functional and access needs population, hearing impaired, visually impaired, and people that may speak a different language. Those were all priorities as part of the development of this RFP, and were reflected as we developed it. So that's essentially why we're here today, is to discuss, where we're at, and ultimately request that we can move the project forward and continue to offer this valuable service to our communities and our partner organizations.
So I did just want to note that we do offer up this service free of charge to communities. So when we had the first system approximately 3 years ago, and since then, as Mark said, there's about 23 communities that need it. Some of them had their own system in place and were able to cancel that contract, and some didn't have a system in place and are able to use ours, but they've been really happy with us providing that service, again, as a shared service for them. Is that the last one? Go ahead.
So ultimately, as part of the process, we selected Code Red. OnSolve is the parent company. Code Red is the actual product. And we went, the RFP, basically, we identified, again, the rigorous technical specifications, some of which were required, some of which were preferred. Out of those specifications, Code Red being in the pool of the 3 lowest bidders, Code Red was ultimately met all of the required specifications and met the most of the highest number of the preferred specifications in our RFP. And a lot of those specifications that I'm referencing right now are dealing with those priorities I mentioned in a few earlier slides, the training element, the functional access needs element, and then the data migration.
So we're happy to answer any questions, sir. I would just like to say that Code Red is kind of one of the leaders in mass notification and notification systems. And it's also the system that the city of Cleveland uses. So again, that interoperability between all of us here in Cuyahoga County, there's value there also, being on the same system.
Thank you. Questions? Yes, ma'am.
If you can go back to your map. So we're saying that there's 26 communities. So those that are not part of this system, what did you say about if there's an Amber Alert or if there's a weather? How do the other communities who aren't part of this get that message?
So there's a couple different things that play. For the Amber Alerts, they're a little bit separate, but ultimately, county citizens, people that work in the county, can subscribe to our system and elect to receive messaging through it, and they can do that even if they live within a community that doesn't use our system. So they just receive 2 messages perhaps on the same emergency, or again, if it's a county news issue, they might receive that message through our system, but not through the system they use in that particular community.
May I follow? So to understand, those that aren't part of this system, are you saying that they receive the notices anyway, just through their own resources?
So, Councilwoman, we have, being the county, there's a countywide system, and anyone who signs up for the service, if they click the countywide box, they can receive any message, no matter where they are, that we send out. So for example, Amber Alert, we would send to everybody that is a registered user in the system. The particular communities that are in blue in this map are, for example, Rocky River uses that solely for their residents, and they send out their own individual messaging. So they might not be countywide messages like an Amber Alert that we would send to everybody in the system, but they would just send to those registered within the city of Rocky River. Does that answer your question?
I think so. Is there I guess is there any communities that would not be receiving a message from us? Are there reasons why they're opting out?
People aren't opting out. It is a system where people have to sign up and register for. So part of it is just getting out there. To Mark's point earlier, if you are a resident in Rocky River, you can sign up to receive countywide updates. You can sign up to receive Rocky River updates, as well as, let's say your mother lives in South Euclid and you can sign up for South Euclid updates. And so again, we could send to anybody, but they are required to first register within the system.
Is there any downside as to why they would not register?
No, when we initiated the system about 3 years ago, I remember the vendors saying 4% population is actually fairly good or fairly normal for these types of systems. And I'm not sure where we're at now, but I know we were above and beyond that. Emergency management does a good job of getting out there to different events, bringing laptops and signing up people on the spot, working with local cities and having them put it out in their newsletter, hey, sign up for Ready Notify. So it's just encouraging the word. One other point is specifically for Amber Alerts also, there's also a different service at the federal level, wireless emergency alerts that people get and their phone rings different times of the night. Sometimes people get frustrated. And that you don't have to register for. Those can go out to all devices. So that's another option for those type of imminent situations or Amber Alerts.
Okay, thank you for that. Appreciate it.
Anything further? Okay, so we would want to move this forward. Is there a necessity to move it quickly?
Councilman, I am requesting to move it forward with suspension of rules. We started this process at the beginning of 2018, but we actually had to reissue the RFP twice for different reasons. And so because of that, our current system that the vendor's no longer supporting ends in March. And so we need to get this and get everybody trained and implemented prior to March. So I do apologize, but the request is to move it forward with suspension of rules, if possible.
If the committee is so willing, I'll accept a motion for Resolution 2018-0251 to full council under suspension of the rules. All in favor?
Aye.
Against?
Thank
Thank
you.
you.
And thank you for moving that.
2018-0252.
Resolution number 2018-0252, authorizing an amendment to contract number CE 1500307 with Midwest Presort Mailing Services for electronic certified mail services for the period 10/1/2015 through 9/30/2018 to extend the time period to 12/31/2022 and for additional funds in the amount not to exceed $1 million.
Hi, good afternoon, Council. I am Laura Black, Chief of Staff for the Clerk of Courts Office, and I have Mike Smotek here, our Finance Manager.
Good afternoon. This is to amend our contract, our current contract with Midwest Direct for mailing services mandated by the Ohio Revised Code.
Were they looking, am I wrong, were they looking to do away with certified and just do regular mail, or?
I think there's been some talk in the state over the years about having attorneys serve it, but I don't know how far that's gone.
Seems to be somewhat of old time.
We'd be all for it.
Yeah, and the cost is quite something else. And looking at the dates, I would imagine this also has to go forward. Are you under?
Yes. We would need it in place by the beginning of the year.
Okay. Questions from the committee? Yes, ma'am.
Thank you. Given that this contract began in 2015, it's been ongoing and the need has been there and it's mandated by the state, why is it that it ended in the end of September? We have now had October, November, we're into December. Why are we over 2 months late in asking for this funding?
Sorry, we started working on it in August, and it took a little bit longer with getting the contract approved by the vendors, attorneys, and the law department than we initially thought it would.
Do you see that now that you know it takes you from August till that next time you come back and ask us in 2022, I guess that's what it's, that you will be able to, given that it's, a service you know you need, it's ongoing, it's mandated by the state, it just seems like this would be a contract that we should be able to get done before the contract ends.
Next time, we will start well in advance.
All right, thank you.
Anything further? Yes, ma'am.
Just a quick question, Mr. Chair, thank you. In terms of certified mail, has that cost gone down because of the FedEx service provision?
The amount of pieces we send certified has gone down. We send about 50 to 60,000 a year certified still, and 50 to 60,000 by FedEx, so.
Are we saving money with that FedEx?
Midwest is saving us money on the certified, about $1.30 per mailing.
Midwest is.
Yes.
But is that, is the FedEx, that's not saving money, that's just another mode of service?
They have a little bit better success rate than the post office, so there's less attempts when it goes on
I see.
FedEx.
So court costs, not direct certified,
Right.
I would say. Okay, all right, thanks.
Everything costs money. Anything further? Well, if the committee's okay with moving this forward under suspension of the rules, I'll accept a motion for resolution 2018-0252 to the full council for second reading suspension. All in favor?
Aye.
Against? Thank you.
Thank you.
Thank you.
Okay, that's our business of the day, our usual business of the day. If you would bear with me, we have a review of the Marshals report that we received. We have Mrs. Carney and Sheriff Pinckney here and their staff. I'd just like to say that the purpose of today's meeting is to address any questions members of the committee might have regarding the report. The Marshals Service has indicated that it will come to Cleveland to review the entire report, but requests that it be an executive session. While I would recommend that we take them up on that offer, I thought it equally important to answer any questions members may have in this open setting. The report speaks for itself, and it's very direct in its delivery. My concerns fall in no particular order to morale, intimidation, medical services, safety, command, assumed financial savings, and program implementation to alleviate overcrowding. Other council members will have their own areas of concern, and we will address those. During last year's biennial budget discussions, it was stated to us by the administration that the goal was to meet the state's minimum standards for jail operation. That has not been this council's goal, ever. As shown by the council's budget amendments last year, we clearly proved that. Clearly, we haven't even met basic human standards as displayed throughout the entire U.S. Marshals report. I would ask that the council listen to each other's questions as well as the answers provided by the administration. I'm hopeful that as we receive information, we will find answers to these serious problems. I am confident that we will be able to turn this ship around in an orderly and timely manner. Before the U.S. Marshals report was delivered, I asked the sheriff to be prepared to report to this committee on his plan going forward. I have identified the necessary funds and expect to be able to deliver this help where needed and concerns where warranted. At this time, I would ask Sheriff Pinckney and Brandy Carney to come and provide an overview of the U.S. Marshals report and answer the committee's questions. Sheriff?
Good afternoon again, Council. Thank you, Brandy Carney, Chief of Public Safety and Justice. I also have our interim jail director, who's also the Chief Deputy of the Sheriff's Office, George Taylor, with us. Sheriff Pickney is here. I think he had still stepped out to speak with the woman from earlier, so he should be back in a moment. So, sir, I know Sheriff Pinkney had some opening words. We can start by fielding questions if you'd like, or if you want us to start somewhere specifically, we're happy to.
You know, what I would like to do is just, and where is he? He's out talking to that young lady?
Yeah, I believe that's where he's at.
Okay, then we'll wait for him. I'd like to mention that Ms. Simon and
Thank you.
Vice President Jones are in attendance.
Sheriff, thank you, Councilman.
Good afternoon. So I missed a question, I guess.
We're waiting on you. If you would take us through the executive summary, and then we'll go from there.
In regards to the Marshals report and all
Yeah,
that?
yes.
Okay, so what we,
However best you think to go, but that's where I would start, but.
sure, okay. Well, I'm sorry for holding you up, but what we did, I received the Marshals report, I believe, last week or week before last. I was on vacation taking care of family business, so I didn't get a chance to really go through it. Some of the items we've already addressed. We addressed when the Marshals were there, and that's in regards to the food used as punishment. We addressed that right away. There was another issue that was brought to my attention that were, I guess, a couple of inmates that were, the investigators were concerned about, so we moved those individuals right away. What I wanted to do and what I instructed everyone to do is to get the Marshals report and the state's report and put them side by side and go line item by line item to see where the differences are. Because we've received passing grades from the state and such low scores from the Marshals. So I wanted to go line by line to see where the discrepancies are, and then that'll give us a roadmap to where we need to.
Has that been done?
We're doing that now. It's a long, extensive report. We met with our our correctional staff this morning for about 2 hours, and we're starting to go through those line items. The state came through,
Go ahead.
I believe, a week after the Marshals investigation, so we're waiting for the state to send us their final report. So we have a report from the state last year, but we're waiting on a report from the state since their recent.
It's my understanding that the federal investigators that do this for a living throughout the United States are much more aggressive in trying to find issues and let us know what the issues might be. And the state is, for lack of a better word, a little lackadaisical when it comes to that. More of a check the box or not check the box kind of thing. So I don't even know if I would wait for the state of Ohio's report. I would just go on the assumption that as devastating as the federal Marshals report is, let's go.
Well, I respectfully, I don't want to say disagree. It's just there's two different standards. There's a state standard and a federal standard. So, for instance, give you an example. In the Marshals report, they kind of gigged us for not paying the trustees a monetary amount for doing trustee work. We don't do that. The state does not pay inmates to do trustee work, where when you're locked away in federal prison or in prison, they do get paid for work. So,
Well, Sheriff, I think that's a little ticky-tacky because, and while I understand that, and there are things in the Marshals report that I understand are not quite as accurate as we like, the totality of the report itself is what we're talking about here. And to juxtapose Ohio's report versus the Fed's report, I personally don't see what you're going to gain out of that. We already have what the bad stuff is here, And the review of the federal performance-based detention standards are for non-federal detention facilities, which are we or aren't we non-federal? That's what they said. That's what I read. I'm a layperson, please school me.
Well, that's why we're going through it, because some of the items that they get us on in regards to, let's say, policy, we do have policies on certain items. And I don't know exactly what policies they're referring to or certain items they're referring to. That's why I wanted to kind of put the reports together next to each other to see exactly what they're referring to.
Fair enough. So, well, let's dive in. Back in May, June, it was agreed upon that the county would pay nurses additional monies. It was told to this councilman and others that one of the reasons we weren't getting nurses even to come consider working at the jail was because we were below market. Take us to market, if I remember correctly, was $3 more an hour. We authorized $5 more an hour at that meeting. We heard nothing else after that, as far as I know. So those increases weren't implemented at that time, I would assume.
I'm going to bring John up from HR.
Sure.
He can answer that question for you.
Good afternoon, Chairman Gallagher. I'm Jonathan Zarulik. I'm one of the human resources managers, work with talent acquisition, and was partnering with the jail management staff on the issue of nursing, so both RNs and LPNs, make sure our recruitment process was competitive. I understand the information that was shared with council earlier that you talked about. Human Resources did conduct a thorough review to make sure that we understood what our local labor market looked like and what the wages were. We looked very carefully, and I have some data here in writing that I'm happy to share with the council, and I can give you this information, that our wages at the entry rate for RNs are competitive within our local labor market. Where we begin to lag is as there is ongoing experience for RNs, and we do have a labor market that we are not quite as competitive as RNs go on in time. That is an issue that we're looking to address through negotiation with the union that represents the RNs. But at the entry-level rate, we did look at our labor market and determine that we are competitive in the local labor market.
Okay, with all due respect, Jonathan,
Yes.
I don't care. We authorize this, we write the checks, and that should have been done. And I'm not saying it's you, but somebody, and it was told to me that somebody determined the royal we evidently, we determined that we were not going to offer that money to create an incentive for nurses to come in. Could you tell me who that we was?
I would have to defer, and I'll
Okay.
get back with you on that.
Who made the decision out of HR?
I would have to get back to you on that.
Okay,
But
because
yeah.
interestingly enough, and Counselor, interestingly enough, this is back in June. July, August, September, October, November, December. 6 months later, we're in a hearing here, and this is very important to what the goings-on down there were. Could you tell me who the royal we was?
I'm not understanding your question. Ed Morales for the Department of Human Resources.
Let me be more direct. The council of this county.
There is no royal we, sir.
That's what I was told. That's what I was told. Quite honestly, if the determination is as Jonathan says, shouldn't have we been notified?
Councilman, my understanding was that information was shared with council or council staff, and the determination was made that the information that was expressed in an open meeting of council regarding the RN wages was in fact incorrect, and that was shared with council.
Okay. Out of that meeting, we authorized $3 to $5 to move that, bump that up. Somebody stopped that. Who stopped that? Who determined that?
Okay, what I would say with regard to, there's a difference between authorizing or informing the executive that funding is available and directing the executive to negotiate a wage rate.
I understand that.
And there was no direction with regard to the negotiation of a wage rate. Moreover, the charter pretty explicitly states that the negotiation of wage rates is an executive function.
Correct. Is there anything in the charter that says that we should be blindsided by the fact that we provide funds to an administration that refuses to do anything that we expect with those funds? And then we have situations at the jail like we have?
Sir.
And yet we aren't, and there's no one reports back to us.
Sir, I can provide you with information, but I can't engage in an argument.
I'm not here to argue, but I'm not here to listen to you to tell me about the charter. We have a situation at the jail that this falls on somebody's head, and it isn't up here, and I'm trying to find out who. And we authorize
Find out
to
what?
get more. Can you tell me if we have enough nurses at that jail today?
I can't tell you that, no.
I can tell you we don't. And I can tell you the direct reason we don't is because we're not paying enough.
Sir.
So if you want to do, Jonathan, you want
Sir.
to do all the Jonathan, if you want to do all that information, that's great. But we were in a crisis mode 6 months ago. We find ourselves in that same mode today. And no one that I know of came to this chairman of this committee or this president of this council to tell us that a decision was made not to up the price for nurses. We don't have enough nurses then. We don't have enough nurses today. The price hasn't gone up. There's a reason. There's a reason why we don't have enough nurses. And I'm saying to you,
Sir.
that and let me put it out on the table. I heard that somebody made a determination they didn't want to get into a battle with the union.
Why would there be a battle with the union
Why
if we
am-
were proposing giving
I
more
will tell
money?
you this. Why am I getting calls from people in the jail about what's going on? Why are others getting?
Mr. Gallagher, you're not making sense. I apologize. I don't understand what you're saying.
I'll tell you what.
There is
you
no,
know,
there would
Mr.
be, that whatever decision was made was not motivated about concern
Of cost?
about a battle with the union. You're suggesting that in an open meeting of council, you directed the administration to pay them $5 an hour more? Why would that lead to a battle with the union?
Because you didn't do it. And
That
some
doesn't-
were
that-
union.
that doesn't
Is
make
it
any
true?
sense.
Is it true? And then we'll leave it at this.
The only
Are some
battle-
are some union and some not? I'll take that as a yes.
Well,
I'll take it as a
sir,
yes, because I know the answer to
Sir,
the question I asked.
we have-
Jonathan, could you tell me, honestly, I'm done unless you have something you can offer to help me out here.
I'd like to answer your question,
Okay,
but you're
go
not
ahead.
allowing me to.
I assume you're saying to me, am I hearing cost isn't an issue? Cost isn't an issue?
I'm not sure I understand that question.
If you're offering people $3 to $5 more an hour to get them to come to work for you, and you don't do it, you know that's the reason it's not happening.
Sir, we don't know that.
I do.
We don't know that
It
that's
was
the reason.
testified to here by the medical staff.
Sir, the medical staff are not human resources professionals. They didn't do a labor market analysis. We determined that it is not wages that's preventing us from hiring more nurses. It's because working in a corrections facility is not
Okay.
a
Thank you.
job that a lot
I-
of nurses want to take.
I appreciate your position. Taking your position, it's got us no closer to any more nurses being hired in the jail. To follow your line of thinking, until the market comes up, we're not going to have any more nurses.
Sir, throwing money at a problem is not always the answer.
Getting quality individuals to work in a very difficult situation is something we need to do. It's unfortunate.
And we agree on that.
Thank you.
And Chairman, I just wanted to provide some additional information.
Yes, sir.
Around nurse hiring. We have been very aggressive about doing so. And we did have a couple of meetings with council staff to make sure that they're aware of our efforts on all of this. We do have right now budgeted for 27 RNs and 25 LPNs. And that is work that we have done very closely with the jail administrative staff to make sure we understand their staffing needs. Right now, today, we are at 18 RNs and 26 LPNs. So we continue to work to fill those, Every vacancy that we post, we get a little bit closer. We want to make sure that we're hiring high-quality candidates that understand the needs of working in a corrections environment. We do get more applicants than we could honestly fill every spot in a posting. We've had that situation. But when we interviewed those candidates, we found that not all of them, right, were going to be successful in that environment. And so we've been very cautious to make sure the staff that we select is highly qualified and prepared to be able to be successful as much as we can.
Sure.
We are continuing to hire, and at this point, we're on track. Our plan is that if we continue to fill as we have been filling, we should be at full staff within RNs by July. We are at
Next
full
July.
by July.
You're aware that the administration has already announced that Metro will be taken over, so that really doesn't help us.
Understood, and we are prepared to shift to follow the administration's directive.
So my point being, well, of those candidates, if you can answer this, of those candidates that you either determined or they determined it's not a good fit, was any financial related? Was any money related? Was that a talk?
No, sir. So when we talk with, so I think the instructive piece here to help inform you is we do make some offers and candidates decline those offers. And so that's always an area where we're interested in understanding when we make an offer to an RN candidate, why did you turn us down? And money has not been a primary consideration for the nursing candidates that we've offered to who have declined to us. There have been other reasons that they have said, we're not interested in the position at this time.
Do you do exit interviews?
We also do exit interviews, yes,
In
sir.
any exit interviews, was money brought up?
The salary was never brought up as the primary factor why the nurse chose to leave in the
But it
exit
was
interview
brought
data.
up.
It did come up in some of the exit
You
interviews,
would
yes.
you would assume it would be brought up at some time.
Absolutely.
Okay. Any questions for this gentleman?
Follow up.
I'll do it committee members first, and then Ms. Baker.
I just wanted to follow up, as a member of the Board of Control. We were asked after the Bedford Jail opened, this is after it opened, that there was an emergency measure to hire some temporary nurses. Has that been done, and are we up to speed as what's needed at the Bedford Jail?
Councilwoman, I can speak to that. So I think there were two separate emergency items that were taken in front of Board of Control. What had happened, and this was approximately July because I had just came into this position, we had a number of nurses that had quit at one time. And so what we did is an emergency contract as a backup nursing contract. So if in fact we needed nurses immediately, if we lost so many by retirement or if they were to, quit the county, we could use that backup contract in the interim while it was taking some time for HR to go through the hiring process. So those were two emergency measures, and then we put in place a permanent, that we still have in place now, backup contract that we could use. Now, it's not ideal to consistently use these kind of interim nurses, but when we really get in a jam, for example, for the Bedford Heights, we were able to pull from that contract and use them.
So just to follow up, so the dollars that we approved in Board of Control as a rush needed after the jail opened, those dollars have been exhausted, not been exhausted, some of them used?
I can speak to the first contract that was initiated prior to my time in May through June. That was exhausted. We went in front with a second $25,000 contract. To my knowledge, that was not completely exhausted, and there is a backup, but I can absolutely provide those dollar amounts to you following this meeting.
And just one last question. So as we stand here today, are you fully staffed with who you need at the Bedford Jail?
Bedford Jail.
I'm sorry.
Go ahead.
Good afternoon, Council. To answer your question, the second mission critical still has 23,933 left in it.
Okay.
That one was in place, and overlapping that, then we got the permanent one in place. So we just left the second mission critical sitting there, and we're using the permanent agency nursing contract. That was a request for bids that we went out for, and that was a $300,000 contract. However, we're using it quicker than we had anticipated, so we may, depending on when this whole Metro Health nursing thing takes place, we may have to do an amendment on that one, depending on when the transition happens, if it happens.
All right, so just if I can follow then to that. So there's 23,000 left of the second
Mission
ask
critical,
of the
yeah.
Board of Control. And again, are you fully staffed at the Bedford now that the funding is in place?
Right now, and I spoke to Metro Health earlier today, Bedford Heights is now a 24/7. There is one RN and one LPN on days. There is two LPNs, one in the later evening, and then one LPN, I'm sorry, through the later evening, and then one LPN through the entire night. So it is a 24/7. So Bedford Heights is fully staffed in terms of medical. That is what Metro Health feels they need out there right now.
All right, thank you.
Okay, and Jonathan, just, if you can get us those exit interviews of the nurses only. Anyone else down here? No? Yes, ma'am.
Just on Councilman Gallagher's last point on the exit interviews, what is the top question on that exit interview?
What is the top question on the exit interview in terms of what question that we ask? We do ask folks a number of questions, trying to think what's at the very top. I think it is within the top 3 questions is what is the reason for your departure?
Okay. Because you stated that there was not a question about money.
Oh, no, to clarify, Chairperson Gallagher asked, right, was money, one of the reasons or the top reason? And no, it was not. As I'm recalling back, looking at the exit interview data for the most recent RNs who departed, we had one who wanted to take another opportunity. We had one who wanted to relocate to be closer to family. So yes, money has come up in some of those exit interviews as a reason. It has not generally been the primary reason why the nurses have stated they're leaving when they conduct the exit interview with us.
And you're
But yes, we
stating
can
that they
provide that
come
data.
up, that conversation comes up, but I'm just wondering, is that one of the questions on the exit interview?
Yes,
asking
ma'am.
about-
So we do, as a part of the exit interview process, ask about a number of topics. We ask about training and support. Did you receive adequate training and support? We ask about the compensation and benefits package, and do they feel that the compensation and benefits package is adequate? And if not, can they tell us more detail about where they feel that that is lacking? So that is a standard question that we ask as part of the interview exit
And
process.
how is that ranging in answers?
I wouldn't want to misspeak, so we will compile all that data for you and be happy to provide it. Again, generally, I will say that most folks express that they're satisfied with the compensation and benefits that they receive. That is not a top reason that I have seen for our nursing staff when they say that they're exiting, but we will absolutely be able to get you a summary of that data.
And how many questions are on the exit interview?
It's a fairly lengthy form. It is about 3 pages total. It goes through a number of different areas, and typically it's administered in a one-on-one interview with an HR staff person talking one-on-one with the departing staff member.
And I know it's been told to us before, out of those 3 pages of exit interviews, they have been quantified or people have looked at them, so.
Yes, so as part of our efforts to improve our nursing recruitment and retention, we did look at exit interview data, made sure that we had good synopsis and summary of that data to guide our efforts moving forward with recruitment and retention.
So you should have some idea what is that top reason.
Yep, so like I said, the reasons were different because we've had, we're not talking about hundreds of people, right? We're talking about, a dozen or less that have left us.
What you're saying is you've already quantified all those exit interviews. You should have some kind of top answer for us of what is the
Yes,
majority reason why
and there
people
was
leave.
not one consistent reason why each of the nurses.
So give me
explained-
top 3, then. There should be top 3. Okay, thank you.
Yeah, I would say number 1, leaving to take another opportunity, right? Not specifically saying leaving because I wasn't compensated well, but leaving to take another opportunity, which could absolutely include, right, concerns about compensation or other things. That's why we dig a little bit further. And then we had some who wanted to relocate for personal reasons.
Ms. Simon.
Thank you. Before I move on, I have 3 questions, but I'm not clear from HR what they've done to bring in nurses from the committee meeting in May and June. What has actively been done and how successful have you been in hiring nurses?
Sure.
In the 6-month period, how many nurses have been hired?
Sure. So again, currently we have identified that we're at 27 RNs and 25 LPNs is the complement that we like. Right now we're staffed as of today at 18 RNs and 26 LPNs, so we're actually over 1 LPN because we wanted to provide some coverage. So far to date this year, we've hired 8 RNs and 16 LPNs. Some of the things that we've done to make sure that we're being competitive and successful at attracting and recruiting RNs. We've reached out to the state and obtained a list of all licensed RNs and LPNs to use that to help develop targeted recruitment with them. We've reached out to local educational institutions that are graduating RNs and LPNs to make sure that we're marketing this opportunity to them. We developed a profile of our RNs and LPNs who've been successful in the role. So what kinds of characteristics do they have? How long have they been serving in nursing careers? What kinds of settings have they been providing nursing services in? So we can target those nurses in our recruiting efforts. We're making sure that we're talking about all the positives that are in our collective bargaining agreements with our nurses. So we have, stipends and things set aside for continuing education, for uniforms, other opportunities that nurses in other settings may not have. And we're making sure that we're bringing up those benefits to our candidates as we're talking with them in the recruitment process.
Okay, thank you. Euclid Jail, Councilwoman Baker asked about Bedford medical staffing level. What's happening at the city of Euclid Jail?
Good afternoon again, Council. So the Euclid Jail is also now a 24/7. There is 1 RN during the day, because it's, of course, 3 shifts. So there's 1 RN during the day, 7 days a week, 1 LPN in the evening, and 1 LPN through the entire night. But they are also a 24/7. We are using, my understanding is we're using, I think, county nurses for these facilities, and then we're using more of the agency nurses downtown.
Thank you. And I'm sure the council colleagues will get into more specifics, but the U.S. Marshal report you've read, and you're waiting to compare it to the state standard report. But what jumped out at you from the Marshal report, Sheriff, that any things that could be addressed right now as immediate fixes that need to be done?
Well, right now, so what we've done right now was we addressed the food issue that was brought to our attention. We addressed the juvenile issue that was brought to our attention, saying that juveniles shouldn't be in the same housing unit as adults. And I'm trying to think of the third. Oh, yes, that's right, the trays. That was brought to our attention, that some of the trays were broken or moldy. So we ordered 432 trays a month in October, and we just ordered another additional 720 trays.
I have to ask about these trays, because I remember seeing something about trays months ago, that the trays were molded or falling apart. And is this the first that you've all heard about the tray issue? I realize comparative to these other issues, it's relatively small, but it would have been an easy fix months ago.
Exactly. Well, this was the first time I heard about the trays. I walked through the jail, I walked through the kitchen. I've never seen any molded trays. Doesn't mean it didn't exist. I just never seen them. And this was the first time I heard about the trays.
Who would have been the one to report to you about these trays?
That would have been the regional director of corrections. That was his area.
Okay. Thanks. Thank you, Chair.
Mr. Tuma.
Thank you, Mr. Chairman. I know we're talking about union contracts and trays and food and things like that, but I mean, in the past 3 months, there's been 7 deaths at the jail. How do you justify waiting for a state report that I can tell you isn't going to give an A+ to 7 deaths in 3 months? That's the real crux of the issue for me here. It's just unacceptable. So you tell me what the plan is moving forward to remedy this ongoing issue, because this just cannot continue to happen at this rate. This is and council, in fairness to council, we find out this information through media sources. We find out there's another death at the county jail. You wake up and read the paper, and another death at the county jail. Surely, it's got to be disturbing to you. So what's the plan moving forward here? And we have health inspectors for restaurants and they give timelines and things like that. I would assume that we, moving forward as a county, can set some type of timeline to try to say, hey, you know, we're going to address and remedy some of these major problems at the jail. Again, I understand, you know, things like food, you know, need to be warmed up. You know, those are larger issues that are out there. But let's get to the crux of the problem here. Whether it's overcrowding, whether it's not having mental health staffing, and that's why one of the reasons I'm sure, you know, Mr. Gallagher is upset with talking about funding, authorizing funding, and nothing being done with funding, because, you know, there might be mental health issues or providers out there that can be addressing some of these individuals who come into this jail and never leave. So I want to hear from you folks what your plans are as far as remedying this issue.
Before you start, thank you, Mr. Tuma. Jonathan, thank you. You can have a seat. I don't want you standing there. And I did, Ms. Tuma, I did meet with Sheriff before the report was released. We anticipated a bad report. We kind of got word that it was going to be bad, so I asked Sheriff to put a plan together, not just the plan, the finances for the plan, and I assume you're ready to go with that. So if you would, please.
Yes, and I'll have Chief also elaborate on a little bit more. So it is absolutely disturbing. My family reads this as well, so none of us take this lightly at all. In regards to what we've done is we looked at some of the things we were doing as far as, let's look at what was used in these suicide attempts or whatever. So we addressed that. We addressed where is the location? Are they double pot or are they in a cell by themselves? Those type of things. So we addressed a lot of those things. Addressed the screening process when they come in during intake, when they meet with the medical staff, when they meet with the psychiatrist. All those things have been looked at and addressed and being addressed. I'm also reaching out to the National Institute of Correction, NIC, to see if they can give us any more direction, any more guidelines. We looked at our staffing issues. Again, we met with our staff this morning. I tasked them to come back to us with, is this an appropriate amount of staff, administrative staff that we need? Those type of things. So we've been attacking this since the first death. And we've just been constantly trying to get in front of this thing. So, Chief, you have any other things you want to add to this? Yeah.
George Taylor, I'm Chief Deputy at the Sheriff's Department. Some of the things we've looked at is training, CIT type training, escalation, de-escalation training, being able to deal with people with drug problems, mental health problems on a better scope than we do now. I guess the one caveat I'd like to put out there, though, is it's tragic these deaths occurred. It's a shame that it was the county. It's a shame that it was the individual. It's a shame that their family has to put up with it. But in our society today, with the prevalence of the drug abuse problem and the death through heroin and opioids, the jail is only a reflection of our community and our society. So we need to not only try to address that in the community, but we need to find better ways to address that addiction problem within the jail, and that includes finding ways to prevent drugs from getting in the jail and finding ways to have people that are about to be incarcerated to be truthful with us about the fact that they did or did not ingest drugs. And I don't mean that to put the blame on someone else, because there are cases where we should have done a better job, but it's just our society, unfortunately. But we're trying to address those problems to make the jail a better place, a safer place.
Are you okay?
Yeah. And I certainly can appreciate your comments. The only thing I can say to that, though, is that, the taxpayers deserve better. These are our families that are going, to the jail. And while there is a major drug problem in Cuyahoga County and across the country, again, once that individual comes into that jail, that becomes the county's responsibility. And so, while there are bigger issues that are out there, there has to be some immediacy to the issues. And I can appreciate the sheriff saying, that, you know, you moved on things after the first death. Maybe there's a breakdown in communication between what's going on there and what we're hearing up here, but that's another element of this. I'd like better communication from you folks as to what you're implementing, what you're doing. Maybe if we have an understanding as to, you know, hey, they're doing some things, they're taking some steps over there. Right now, the appearance is that, you know, people are dying left and right and nobody cares, okay? And we know that you care, and, you know, we need people out there to know that the county cares. So actions always speak louder than words, and that's what we're looking for, is action. Thank you.
I asked you for a plan and a finance on that plan, what it's going to cost. Is this what you have for us?
In regards to that, we are still working at, Chairman, the plan, because what I did, I reached out to Franklin County, Hamilton County, and Montgomery County to see their staffing levels, see their plans, and trying to match it up with what we have, and then getting with our fiscal department to come up with a complete plan. I don't want to give, I respect the comment in regards to the communication getting better. I anticipate that will happen. And I don't want to give a half plan where I'm still reviewing what Franklin County's plan and their staffing levels are, and Hamilton and Montgomery. So
When could we anticipate the reveal on this?
That is a top priority, as well as this jail issue. So we're working on them simultaneously. So hopefully by the end of this week or early next week, I'll have something for you.
Have we already advertised for Director of Regional Jails, wardens, and where are we at with all
We have
that?
not advertised for the regional director. That's one of the adjustments we might make in that plan, as looking at it with what Franklin County does and Hamilton County and Montgomery. They have a jail administrator as opposed to the director, and that might be something that's conducive to what our situation is. So,
Okay. Did you have something, ma'am? Yes, sir. Mr. Brady.
Just to join in a little bit, I'm seeing two main issues, and there may be many more, but there's two that I'm looking at. And we've got a list of questions here, but I can tell by, you know, where this conversation has gone so far that there's not much point in asking several of them because you don't have the answers to them. But there is a matter of resources, and then there's a matter of who's in charge. And these both are very important, and they're both complex. I was astonished to have the administration come up and even talk about the value or the wisdom of throwing money with the words that were used at a problem. We've had a knockdown, drag-out fight for over a year about providing services for this jail, and then it's referred to, in whatever context it was, as throwing money at a problem. I can't believe that we would pretend as if we haven't been having this debate, and I'm not talking to the three of you, even though you're in front of me. You know, we've been having this debate for a long time, and we have signaled to the administration on several occasions about how unsatisfied we were and about particular individuals, one who is famously gone now. But to act like we didn't know anything until the U.S. Marshals came in, that's why the U.S. Marshals were brought in. And so we would need to know what kind of resources are needed here and have the administration not fight us on providing the resources that we need for this jail. That's the problem, and one of the significant problems over the last year since the last budget process. The second part of it is who's in charge. Who's in charge? The guy that was in charge, he's gone. We can't ask him. Who's in charge? Now, I know that the chairman has some opinions on this issue, so I won't go into that right now. I have to share some of those opinions. But you know, we're people, the people in the community, like I'm sure happens to all of you, they come up to us and ask us about these issues. And they ask us what we're going to do. They don't, you know, it's not Mr. Taylor made, I understood his points were on, I understood you were on point with what's going on in the general population with drug abuse and how that's part of the problem that we have here. But we have people ask us, what's going on in the county jails and what we're going to do about it. And so whether that's over our skis or whether, that's not what the charter viewed us as doing, it looks like we have to do it. There have come times here recently that, the council has had to pick up the slack here, has had to do something about what the crisis were and what the challenges were in this county, because we're not seeing enough leadership from the administration on a variety of issues. So I'll leave with that. I think you get the point.
Mr. Jones.
Thank you, Mr. Chairman, and Council President literally said everything that I was going to say. When I took office, this was my first elected office, fixing this county government was at the heart of what we were asked to do. And I feel it was in the DNA of everyone that was on this council that we came in fresh, wide-eyed, and wanting to make change. And it's on our plate now. These type of things that are happening. I'll tell you this: when I was chair of Health and Human Services, Councilwoman Conwell can echo this, but she's the chair now. But we stood and we would ask what was needed, and the Health and Human Services directors or whoever would come before us, if they were given instructions in terms of, as the chair said, organizational wise, they would say things like, "I can work with the dollars that I have." But behind the scenes, they were asked over these years whether to cut everything by 10%, whatever it is, give cuts. Those were the things. So they stood before us and said, we can do what we can need with the dollars that we have. Now, our mandate was economic development in this new government and human services, which we have always done. Okay, human services was not as sexy as economic development. Going before a plain dealer and saying, well, what have you done? How many jobs have you created? That's the sexy stuff. But the human services is the critical things, and that's what this council has where its heart has been. Okay. So, but here's what I'll say this: what the seasoned and experienced directors have done, and I'll use Richard Jones as an example because he's not here. Okay, he is retired. They stand in front of us and say, "I can work with what I have," but they would come to us and they would say, "Listen, these are the critical things we need." Okay, council, this is, if we're going to be, we're going to protect lives, if we're going to be efficient, this is what we need. And then it was on us as council to fill those dollars in. That one component or tactic didn't happen here. We need to know, why should I have to read it in the newspaper when it's supposed to come from across this podium? The administration that you respond to, they're not here. There's no one sitting at those stations over there right now. You're here, so we have to talk to you. But as the council president said, organizational-wise, who you report to, who is, we don't have an organizational chart. We need a chart of who reports to who, an accurate chart, not how it looks on paper, but who speaks to who. Okay, we need to know that. In this very committee, there was a gentleman, and I'm trying to remember his name, Gary Brack, who stood here and made comments, made bold comments. Okay, I don't know where he is now, but he mentioned the gentleman who was not here, Ken Mills. Okay, this was probably back in May or so. So that speaks to the organizational structure. Okay, what is going on? We need to know what is needed, and we need an honest conversation. And transparent, the new government requires transparency. So it has to be said across this podium, or in some way this council needs to know, so that we can do our jobs and make sure the dollars that you need to be effective are there. This report, what we call the Marshals report, it didn't say anything about the kids, so there's no blame there. They pointed to what needed to be done by the administration. Okay. I'll ask you one question, because I think you've got the sense of what I'm saying. One question there, in the Marshall report, it mentions red zones, a refusal to install shower curtains for detainees housed in the red zone. They are not afforded not privacy when they're eventually allowed to take a shower, and and the sense that it's saying here is there are, let me go back and read it word for word. Denial of detainees to perform hygiene. Detainees are not allowed to access showers, telephones, and recreation due to CCCC's implementation of a lockdown system known as Red Zone. The Red Zone detainees management system is used as a means to address insufficient staff and staffing shortages. So they are kept in, and it says for 27 hours at a time, they're kept in their cells simply because there are shortage in staffing levels. That's what the Marshall report says. How do you plan to address that?
We've already started addressing that situation. My directive was that if we have to red zone, people are only left in their cells for as short a period of time as possible, even if that would mean that they only get out for an hour or two and get to go to rec or get something to more or less stretch their legs. Red zoning is not caused by a staff shortage. Red zoning is caused by staff calling in sick and not coming in. Saturday, there were 40 call-offs on day shift.
So you don't agree with the Marshall report when they say to address insufficient staff and staffing shortages? You don't agree with that?
I'm saying that red zoning is caused by staff shortages caused by staff calling in sick. When staff doesn't call in sick, and I believe yesterday there were only 4 sick calls, there was no red zoning.
So they call in sick and you're short. Is that what you're,
Basically, yes.
what you're saying?
Now, you can always use more staff. I'm not gonna,
This statement implies to me there should be an increase in staffing levels. Do you agree with that?
based on
the Marshall report saying insufficient staff and staffing shortages is the reason why our children are held for 27 hours, well, not children, but detainees are held for 27 hours at a time because of staffing shortages and insufficient staff.
the staffing level we have now could most likely be improved. But even with that improvement, if sick calls are so high that we can't manage the facility, we go back to red zoning. So the problem is more than just people not coming to work or hiring more staff. There's other issues that need to be addressed so people come to work.
Okay, Ms. Simon?
Isn't there a backup plan when that happens? I mean, doctors have backup calls and they have people waiting if there's too many sick calls. Isn't that something that should be in place, is to have some kind of backup plan other than red zoning? Or you don't have enough staffing on call?
Okay, staffing on call becomes another animal in itself.
Okay, well, why hasn't that been discussed or addressed? I mean, obviously, this is a problem that needs to be addressed. You've had a staffing shortage, you have red zones. Why? I don't understand why it's taken 7 deaths, a Marshall report, to stand before us today to do anything. This is just mind-boggling to me. What, you say it's another animal. Well, why hasn't that been addressed with the council to say, look, here's the solution, perhaps one option to address the problem, and ask us to help you?
Okay, I was not a part of that process.
Well, who was?
Okay,
Who's,
It would've-
okay, I just want to stop. 7 people have died, and it's not without any kind of warning, it's not without discussion, and I'm going to go back to these trays, not because the trays are important, but because they're emblematic. There was a July article in Cleveland.com about somebody reporting these awful trays smelling like feces. This was a July article in Cleveland.com. I saw it. Nothing has been done till now to address that. I want to know, Sheriff, you said you didn't know about that. I'm going to ask you, why wouldn't you know about an article in Cleveland.com and somebody reporting a guard in November of last year who reported this problem? Why wouldn't you know about that? You're the sheriff.
I can't answer why I didn't know about that. I didn't know about it. And
Okay, well, there's a problem. And instead of just saying I didn't know about it, isn't there some urgency about why you're the person in charge of this jail? didn't know about something that was reported in 2017 and then in the media in July, that's a problem. And if I were in charge, I would be going crazy that somebody didn't inform me of that, but instead it's just like, well, I didn't know and I don't know why. You know, this is 101 leadership.
So let
I'm
me-
sorry, Sheriff, but you know, I knew about this.
I don't want to come off like I'm being blasé about the issue. That's not my stance at all. It is alarming. It is concerning. In regards to why I didn't know, that is a direct reflection of the leadership that was there.
But you're the leader.
Well,
Aren't you reading what's going? I can't believe it. No,
No,
I'm
no.
sorry. You know what, Mr. Chair, you can take over, but you are in charge. It's not reflection of someone else's leadership. It's your leadership. And if you weren't informed about this report that came through, that's something I have to question why you're not informed about what complaints are being made. I understand you probably get 100 ones that aren't significant, but this was. And then if you didn't catch it because someone below you didn't report to you, then why didn't you read the Cleveland.com article that everybody else reads every day? Don't you get notifications about what's happening at the jail?
Ms. Simon?
I'm sorry.
That's, no, these are legitimate questions.
I'm done.
And Sheriff, we know why you weren't being told these things. We need you to tell us. It's time. The time is now. Because when we're done here, I'm going to say a few things. So you might as well say them before I do.
listen, I do want to set the record straight in regards to the deaths. We didn't wait till the 7 deaths to act. We started acting right away. So that is a misinterpretation of.
We understand that.
So-
We agree, we understand. Hey, you're a good guy. I know you. We understand where you were at. What I need you to tell me, and what she is asking you, what was going on in that jail and why?
Well,
Again, if you don't want to answer that, that's fine, but I'm going to tell you, because I know. And you know I know, and you know everybody up here knows. This system's broke, and this is why. You should be blurting out exactly why this was going on. And because of the way this is set up, you feel uncomfortable to do it, and I get it. You got to feed a family. So do I. I'm in a little bit of a different situation, and we need to fix what's broken. And we're trying to, as gingerly as possible, get to how this thing got broke. And we know how it got broke. So there's the tracks, throw the bodies.
Well, I do respect that. I really do. And you know me. That is not who I am. I'm focused on it's broke. I want to fix it. There's been situations to where I took over the situation and fixed the problem. We have an opportunity here that who was responsible for that is no longer here.
Mm-hmm.
So I'm focused, and I'm really trying to take this opportunity to fix the issue. So
I think, committee, I think it's almost counterproductive to continue on. I honestly thought we were going to have a plan put before us. I understand and appreciate the fact that it's going to take a little bit more time. We have some serious questions as to our constituents. I'm not asking questions for me. I'm asking questions for people that I represent, as we all do. And we are treated, as we were earlier, as some redheaded stepchild. We're not. We're done. This is not unique to you in this administration. When this came on, Levert was McFall and the previous administration and the way that was set up. The people of Cuyahoga County changed the way in which their elected officials were going to be representing the electorate. Enter us. The Fitzgerald administration had Sheriff Reed, who they adopted when McFall left. He stayed on. There were troubles there. the troubles there between the Fitzgerald administration and Sheriff Reed are somewhat similar to what we're dealing with today, which now in my mind says the system's broke. It's not you, it's the system. It's not the administration, it's the system. And it's funny, I called these folks, these previous sheriffs, find out what the biggest problem was, and it was the jail and it was medical in the jails. And the great concern that these gentlemen had going forward and not being able to get that done, we came on and we fought tooth and nail early on, and I'm sure you're aware, to get Metro in there. We didn't have a captive audience with Metro's board. The new CEO came on, Dr. Boutros took over. He called me personally because he read everything that we were fighting for medical in the jail. And before he accepted the job, or he had just accepted the job, he called me from New York and said, I've read your concerns, this will get fixed. The weight of the world was off my shoulders. We finally did it. We got someone to listen. But we're still here. Metro was the solution. We knew it. And now they're going to take over in January, February, whenever it is. But that was not until a big fight with this administration over medical at the jail. So I'm hoping that this is going to be behind us, and going forward, it's going to be fixed. But we have legitimate questions of a horrendous report that I think going forward, until you're comfortable with your plan and you can present that to us, I just think it's counterproductive to move forward until you have the chance to do that. And I think we should afford you the chance to do that. I don't know what the committee wants to do, but I think that's only fair to you, because the only person in my mind right now that's going to fix this is Cliff Pinckney. Not Gallagher, Pinckney. Not Boutros, Pinckney. Not the administration, Pinckney. And if they don't let you do it, we're going to be back here in 4 years with 14 deaths, with new people wondering what happened. This has been consistent, and again, I have to point to the system itself, not the individuals. I know you've tried the best you could. I know you have. So unless anybody wants to follow up with questions, I would hope that we could do that, but.
If I
Ms.
can
Baker?
just offer maybe a solution or maybe a reason why we haven't done past solutions to wrap up my questions. This isn't the first time that the jails have been overcrowded, and in the past, we have done things to try and alleviate that overcrowdedness. I agree that the system's broken, and whether we were at capacity or under capacity or over capacity, you have issues that probably would have been ongoing, but at least in the environment of capacity, can we talk about perhaps back when we used to send some of our inmates, when we got to capacity in the jails, to Geauga Lake, to Solon, and other jails throughout the county? Is that perhaps something that we can reconsider when we hit the capacity levels, which I'm sure you know what they are? If I may also ask if something can be considered, we, back a few years ago, had the ankle bracelet program. That was for pre-trial. Now it seems that we are using them for probationary services. Can we consider perhaps going back to the bracelet of being used for pre-trial to alleviate the overcrowdedness in the jails? And finally, if we could also think about how many of those that are in jail are waiting for their trial. How many perhaps can't make bail and are then sentenced to jail? Can we reconsider perhaps, and those that have the authority to reconsider, how we have how we determine who goes to jail and why, and is it funding? Can the bracelets be used? I'm offering that because, you know, in the reading that I have done, those are solutions that have been done in the past, and can we please perhaps reconsider and bring some of those solutions back to alleviate at least the overcrowdedness that only exaggerates, it sounds like, what we've got other issues to overcome. That is my comment, Chair.
Thank you. And this is a multi-layered, multifaceted situation that needs cooperation from everybody, and from the judges down to the COs who are calling in sick. and after a football game. And the reason they didn't do that when McFall was sheriff was because they get fired. Yes, sir.
Thank you, Mr. Chairman. Also, along these lines, with respect to, you bring a report before us, we have to have a timeline, a time frame. Obviously, there's a sense of urgency with doing this. There are literally lives at stake. That said, we want to make sure that we take the necessary and proper steps moving forward. But again, I know the chairman indicated that you have costs associated with this. But what I'd like to see from my colleagues on council is something summarizing your report, what you guys can do immediately, or what steps have been taken already to address some of the, I guess if you call it lower level issues, and then what some of the plans are in place to address some of these major issues, including overcrowding, as my council colleague alluded to. So if we can have an ERP timeline on things, we certainly can have a jail timeline on things. So that's what I'm looking for. Okay, thank you.
Guys, we're going to set a timeline to come back here. And the only reason I'm going to do that is because we have to have a guaranteed flow of information. We don't have that right now. So if that's the only way I can do it, that's what we'll do. Mr. Brady.
Thank you. Just closing remarks. My view of having sat on this council for 8 years and been part of trying to build a new county government here and make work what the charter put in place. I'm beginning to have some concerns about the part of the charter that has the sheriff appointed by the county executive. It's not the case in Summit County. It's not the case in Allegheny County, as far as I can understand. There is a reason. There's a reason that some counties have kept the sheriff's office separate from the county executive or the consolidating county government, which is a good thing in many ways. But we did keep a separate prosecutor, and we did it for a reason. It seems absurd we wouldn't. I remember at the time, 9 years ago, 10 years ago, that one of the things that came up most often that people were, if they were not certain about how they felt about the charter amendment, it was often the sheriff's office. They somehow intuitively understood the sheriff's office was different. And it seems to me that after what we've experienced, that the part of the problem we have here is that the sheriff, and you are the sheriff, and that you and your predecessors have not been given the authority. I don't believe when they wrote the charter and when the voters passed the charter, they meant for the sheriff not to have the authority of the sheriff. The fact that the executive would appoint the sheriff did not mean the sheriff would not be the sheriff. The sheriff has to have the authority. That office has to have the authority it needs to run such a complex, important, and sensitive part of our county government. And I do not think that the current setup is working. We have people making decisions about resources for jails who don't know anything about jails and won't listen to people who do know things about jails. That will not work. And if we can do what we can, and we have important things, this was not a magic bullet, but we can put this on the ballot. The council can put this on the ballot. We can return to an elected sheriff as part of this reform. And we can let the people decide who's going to run this jail.
Anyone further?
The chairman, president keeps stealing my thunder. All right. Our Cleveland Cavaliers are, I shouldn't say it this way, but they're tanking. But the players don't. Players expect to get their paycheck. They're playing for a contract. They play hard. Above them, other things go on to win or to not win. Somebody around here is tanking, and it's not those standing here at the podium. You're doing the best you can, but Chairman Brady just said it. There's other things going on. The organizational structure and the resources are not right. They're not right, and you're doing creatively what you can within that, but it's right here in black and white in this Marshall report, what's going on and what needs to be addressed. And something needs to change around here. Time to stop tanking.
Thank you, sir. I want to close this out, but Cliff, if we could, and I'll get together with you, we need a time update, and we're going to have it in public. We have to know what's going on. It's the only thing that we're going to, I kind of thought we had the public coming our way after the recent past unfortunate situation. I think we're losing them again. And I don't think we can afford to do that. So hopefully that's something that you would be agreeable to do.
100%.
But if you would bear with me, I had something to say, and I think most of it's been taken by my friends here, but I'd just like to finish up by saying the county council fully supported the executive's decision to ask the United States Marshal Pete Elliott to help in a review of the county jail. Marshal Elliott recommended that the United States Marshal Service Prisoner Operations Division provide an overview of operations at the jail facilities in the county that are under the sheriff. The review was done under the federal performance-based detention standards for non-federal detention facilities. The thorough review conducted by the U.S. Marshals led to a devastating conclusion. The result was an unsatisfactory at-risk assessment. This outcome resulted from many factors. While these issues do not fall on one individual, but it spans over multiple administrations. I wouldn't be doing my job if we really didn't identify Mr. Mills as having a significant role in how the jail was being run on a daily basis, leading to such poor findings. However, he was not alone. The sheriff and many of the others that are up here today have to accept some of the blame. How much is open for discussion? And is it worth going into? I don't think so now anymore. We have to look forward and not look back and fix this. From my perspective, the most glaring factor is that the unelected sheriff was not permitted full reign to oversee his charge regarding the jail. I will state that when a sheriff or any other administrator is moved to the council for confirmation, I expect that individual will have full authority to perform their duty to the taxpayers of this county. There is no question that Sheriff Pinckney did not have full support of the administration. He serves at the pleasure of the administration. It does not excuse anything identified in the U.S. Marshals report. It does, however, leave me with many questions regarding chain of command responsibility throughout the jail. The sheriff has to be permitted to be the sheriff. He is the one with the law enforcement background and necessary experience to run a jail. Others in the administration building do not have the knowledge to effectively run such a unique operation. Clearly, this aspect of the charter form of government is broken. I believe strongly that this would most likely not have happened had the sheriff been a separately elected official. I believe just as strongly that the council should discuss in the near future on whether or not to place this issue before the electorate to elect a sheriff by the voters, to be judged by the voters. As an aside, I have confidence in this sheriff as someone who can rectify these findings. Make no mistake about it, I have great respect for Sheriff Pinckney, as I have had with all the previous sheriffs under the new chartered government. We are often reminded of our position regarding the charter as we were today. For those that are concerned that we, the council, are swerving outside our designated chartered lane, I remind you, we have oversight responsibility. Expect us to use it. Good luck. We'll see you soon. Anything further? Any final comment?
No one has signed it.
Thank you. Thank you.
Thank you.